hospital system on the Juma this week, shut it down. Matete last week and so now they were issue with it. You have 77 million. Emma company be so call hospital. And when you say do for the better doctor when they call pharmacy, a software be doctor ni be who diagnosis here the man pharmacist ni be who know the drama and a shot in the chinwa bahon. Kwabena Mintah Akandoh health minister updated country no. Now we have a lot of questions about it. Near Banner say your call hospital information say ye general say BSc India. And an information ne koso. Na MPP ni ndisi na minyo go bika. Based on information a minister edema and I'm not better on the critical analysis and make sure so be subscribe and most subscribe and click bell notification me the video be to ma obehu na watimi ahebe we are no eja comment in the comment section no akọ app any Play Store e wanna pan rate go download it na for send discover again be any bejo is the best platform you get the best rate to remit money home mo be kaya okọ hospital ni ofidie bi a ye gina so ye wonhwehwemu ene ne manema bi hu apomodi ni bi hu yase be su folder manu ane ade na system e koso in fact my experience with tech hospital a beautiful system bombshell hospital I think say a private facility on a type of tech hospital there man you be ko ho amako experience bi da na shut it down ene be ye chi no send it be so mutwa contract nim on be so mo de command this ni ene ade contract ni na be 31 December 2024 Kwabena Mintah Akandoh say nkrofo na watchire no niam no mo yentia contract no mo tena asante ase anya dwuma no enie
nti na ye analysis no gaba ye establish ye no na ye be $18 million obi again somewhere last year they were giving as part of the 77 million no they were giving about 10 to 11 million dollars bia. Now, we have 157 facilities. You come out of the 157, no, my 7.
7 out of
7 out of 157. Inti audit ni muno, for us, God, you win na. Near look. I know the near ma yenemo abeka wasem. Now, send a young person disruptions be bad because of the software in Intino. Yen sign service maintenance agreement. We are ready.
Okay.
To sign that agreement with you because Obi again one of the serious mistakes are stating here and they say who state one own the software and yet because one OTD now a Lightwave health information management system.
Yes.
So what I say inti enye dia exclusive license 2 years renewable and state in the inti e ka say okay you know sign service maintenance agreement.
And the service maintenance no na any part of the original agreement.
No. Agreement be a original ni mundi and the wu.
Okay.
So and the wu enye adwuma bim there's no that agreement or contract doesn't exist. But what I say but maintenance agreement because of software in the person no sign agreement. Oh how reasonable we were. In that sadia monfa data ne mayen records any kwan say obi atimi ho sensitive monfa ya de mayen na mama ya administrative access to the service near there.
Yes.
And son I will take it from there. Yes. Vendor ne say something jaba say on person obeti any issue about data.
The vendor?
Yes. Again or say the condition back when they say we should write it as part of the contract to say means you now verify 461 facilities instead of the 450. Yes, sir. Obi, at that point, some make a saying, not the Ghana Diagro held the whole country to ransom. Nigeria, no, I saw Nibufu and no doom no. And this Nyamnam America, you can talk to all the. I'm very happy. So one Kasakra cats will be free.
Yeah.
The whole country. Obi, never say. You see the pay again a kwanya ye fa so a enya fe me be jaga na ho for say me be press conference problems are me komunie. The obvious question is and so what as a minister and you guys be lament into me ba be lament because also say discussion across for a very long time but me can be
sure
me ba be can be no also me solution.
Yes.
So we must have a solution to the problem. Nti obi ye we nyina e hu say for the past 2 weeks was shutting down the system entirely in the whole country. Only, I mean, are demonstrating bad faith. Mean, finally, say even if which doesn't exist, there's even a problem to be dealt with. You go to that extent.
Into the whole software was shut down.
Shut down the whole hospital. Be a kolebu people that we a statement on. Free be a was shut in. System be omushi limbs be a shut in.
It is not at the time no Oko hospital.
I know the man I say no more exactly. No, I'm 4 years old. Cash and carry a bus. What's our story now? National health insurance. It mean verify near the other. This is what we went through. This is what we went through. Inti obi, you identify problems. Na be share. The idea be drew her. Now see a solution to the problems one after. I didn't idea be drew her. One, because software no enye dia as a state. Inti bibi ekwe bia da say enya software ye dia. Ghana ni a why ye hwe na yenko Atlanta.
Yes. This one no Limbs nenye a Ghanaian company.
Well, he's a Ghanaian, but he lives in Atlanta.
He lives in Atlanta, that's fine.
So what I say. In fact, maybe one of the things I remember is that they brought an invoice here to Omokanti Intia. Invoice. So I asked them, Kwabena memfa so am interested in now channel being because me dig
where they are buying sika.
You can't just go and bring invoice say tria. Especially when the contract has expired. Especially when they've given you $77 million. Inti, maybe I have to say this. Inti, when we offered the service maintenance agreement
to
now, if he said Anke be factor no nyina ankra agreement, then be the basis of paying him something. This was how reasonable we were. This was how reasonable we were. So if I take office in, let's say, February, later now by April, now so by demand Mintah, abra me understanding the system, abra me auditing. What do you expect me to do? What do you expect me to do? But I make out myself. If he knows something I don't know, you should bring it out. And look, as I make, I won't mention this, but a lot of people, they are gurus in the system. They understand what I'm saying. I'm telling you. Some of your own colleagues have reached out to me. Now I've given them the breakdown. They've also reached out to him.
Wow.
He cannot come and tell me he has not received more than $77 million. He can never. Because any man namdeka. The sources of Weno.
The records no.
Records no. In fact, if you are disputing, we put the anchor very simple. Oh, my year 500 facility. Me say why 450. And year 50 na my account any intimate evidence na me kon cover. Enya no ano. We are there jin ochinya bibribi. I was our social system be off. Inti at west even if Ghana womra sa buy ACC go to court. Yes, so she are there off. They make answer ni makacha answer ni.
You could have gone to court.
Go to court. So buying ACC me or the make say yes, so she are there off. Are you not holding the whole country to ransom? Are you not blackmailing the country? Catch me if I'm lying. Am I learning? Mrawum. In this officer buying crime ACC in the Air Force Street go to court.
But for
and
him,
enforce the law.
But for him to have gotten to the point or best switch
that is dangerous.
But does that not also mean say Ebiana we're doing a wet end?
How can you get to your wet end when you even 1 year cry? How? I don't know. I said just say. How can you get your wet end when you have received $77 million from the state out of $100 million? Abra why 400 yemfa say Ebia facilities as of 400 dey be class so yemfa ne sa krana. You are left with less than 30% of the money. How can you be that? How can you get there when even last year, early part, from the whole of last year, Yamau almost $10 million, also the 157 facilities, how can you get to that level? How can you get there? And yen money yana makanon from mamu. Ebi how many canon from mamu? Yen what some of us have gone through because of these things, you have no idea. Yes, sir. We don't do that. The country doesn't deserve this. Into the now yen say me yen say the government will be compelled to deal with me. Into none nasa within the short once say one who bisa say I don't know more harder than now. Then when he never thought say it's possible, say bet me yes sir. And we have no option than to deal with him. It's blackmailing tactics. Yes sir. I buy ACC wa court. Sani ye.
Yes. no we na obi buza na say papa yi wo ye sure say company fofra mo kofo ma bayi Ghana fo menya amane asemi ma ho attorney general nim ne wuye minister wo ye sure say asemi ma ho da chi be fro say bebusa question ba answer questions ana no sisi
okay.
And I took up the challenge.
Okay.
I was not even prepared at the time. And then they call parliament.
Okay.
I had to go and respond to about 12 questions. 12 questions, you know, on average, but I could be more than 4 or 5 supplementary questions. And it was one of the questions, you know, and I mean, it's not a main question, but why not? Who a press conference, open platform. Ghana for Parliament is one of the biggest platforms you can. Into omo request here, why not? I'll go and answer at any time. I have nothing to hide.
Okay. And the onboarding onto this new software, it may take how long based on more plan?
We have a 5 weeks, 4 weeks.
4 weeks plan. You have 1 month.
Yeah,
and within that 1 month period, no. Say, and me ko hospital. Now, if you are onboard, me facility now. I have to go through the manual.
Yes, for now, I think they have their own way of dealing with the things. And you know, we are confident to say, 4 weeks plan. And now say. But traffic in 1 year,
yes,
from the teaching hospitals to the regional hospitals. And some of the pilot they are doing. I just spoke to the regional hospital, and I mean they are doing the training. They are almost done, and very quick. So the recruitment is huge because they are attacking the hospital simultaneously. Because within a week we are taking on more than 100 facilities within a week. Emergency, we have no option. So what I say, we don't have the luxury to wait for anybody. No. We don't have that time. No. We don't have that time anymore, unfortunately.
Are you confident as minister, say, every decision you've taken relative to SASEM when above board, as a old vendor, or quarter, the state will not incur any judgment debts?
Beside me quarter. I also call.
No, I ain't doing say or kwasa any day.
Obeti me akọ court when number 1. Ebia you are terminating the contract unlawfully.
Unlawfully, that's true. That's true.
You need any contract. Say me fan say assuming without admitting and no cre. Yeah, the car crash and your court now you write to us and you justify. Say what they make say into mometria. Nasi ye entria. The audio court me boy. Yes, so the car, yes, so write to you for Inti, well, court the send I say don't get your car, you know.
Be a bit to me. But as minister, you are confident every decision
and
is above board.
I don't just take decisions.
Sure.
You understand?
Sure.
I don't just take the decision. I've told you, as I speak to you now, we were Attorney General.
Advice, maybe, okay.
And let me, I can only flash it to you.
That's true.
I have the Attorney General's opinion. I'm a veteran,
now we'll go through.
Exactly.
Okay.
Until we don't just take decision, every medical culture says all the stakeholders are on board. Stakeholder I was say your money who the you are doing it.
Okay. Okay. And that's the AG's opinion here, Office of the Attorney General. Very well.
In as much as say a year emergency situation, you need to daho. Until say wako on my nakasa software.
Yes.
Me no yenya exchange no. Me ensa ye ko ye nimede an ye beye. Ni nyina no we are doing it with speed, a certain speed. We don't have the option.
Very meticulous.
Yes, but we don't have the option to wait.
Now, this is what the minister is saying. Permit checks, no. Now, contracting any company send you that no. 100 million. Now, so we 950. And my 450, according to the ministry. I've not seen a denial from the company. And I am almost 77. Simple math, I mean, minimum says a 950, no, right? Divided by 2. 475. It is a 475 crown on me. So we have about $50 million. It's a then you $77. Question number 1. How did we arrive at paying them $77? Is it that teaching hospital no? Or we are a district hospital? Any idea? The minister must give us answers. And yes, I check contract, and new contract in Timbi, BBM Debbie. It cannot be. So, 1. How did we end up paying $77 million not per massive, not about $50 million. We need to know. 2, you almost signed contract. Let's say 31 December 2025, meaning that you were supposed to deliver the 95 facilities within that time frame. Why couldn't they develop it? Was there a key performance indicator in the contract? Nah. If yes, who was supposed to check it? If no, why was there no key performance indicator in the contract? The question 2, no. 3, how come say Ghana buying eco sign contract say your health records are here 7 is will be chrome. I'm not an IT person. I don't want to pretend say yeah. The third question is that the best practice? Nah. Same on the 3 no. Say yasasa ni eco company for GHIMS de na. Omo no omo ba no so no 7 esi hifa. Will Ghanaians have access to the data? The final question is in the Ministry of Health. Can University Computer Science ayaye, engineering ayaye, okwa senior desk software ni adebiano. Can't the government of Ghana because you are a private entity? Can't the government of Ghana has its own indigenous, locally sourced, locally produced, locally built software ya yedebe share pomodi ana? These are the 4 questions I'm asking. 1. How did we pay 77? Where per mass they say it will be 50 million. Is this a hospital need to see without going to the financing model? Nah. 2. The KPIs. Was there one? If there was not, the minister must tell us. It is the final one. The parliament must call the minister. Full debriefing. Both the former and the current of they should explain to us. Because me idea no and to chuma so kakra. And when it comes to the government of Ghana money, I'm always skeptical. MPP and this you minyomuni. In Crawford Bay, MPP ba, I'm some finding reason behind no many problem. So problem and now what back on let's solve it. So that we improve the contract with this new person within the 4 weeks or can. And Sanya Benya another issue. Health for dear. And not dear, I see a toy with it. We shouldn't toy with health. Like security, we shouldn't toy with it. The minister, many questions are me woni. Se video ne kan sa answer mame. Se parliament is will be video na monfree minister. At least it's a servant of Ghana. No man answer questions we mame. Etwetwema so. Minim so dey bia what ya say na so betime educate here. Feel free and educate us in the comment section. We are now subscriber one. Subscriber na click bell notification no me the video be atuma. Ubehu na watimi ahyebi. Say the bia me kan me hiam Ghana so hiam. Make sure so be show so you dem take off yourself. Bye bye.